Okay, I'm not sure kung narinig ako or hindi. Kung narinig man ako, good day, good evening, and welcome to it's evening na. Nasa hospital ako. Medyo bumubulong. Sorry guys. Sino man yan nandyan. Hello. So, for this afternoon, I just want to add a quick discussion about diabetes. This is a very quick video. Siguro, majority would be reading or watching this siguro on replay na lang. And I just want to add some highlights. Kasi today, there are a lot of patients who are diabetic who've been seen here in the outpatient clinic sa amin dito sa hospital setting. And I just want to emphasize, how can we help them? Okay, prevent complications. Again, there are two types of complications of diabetes. You have your macro and microvascular. Macro meaning, syempre, kalakihan. Mga complications that are very much full-blown, malalaki, at there's usually severe. Microvascular, those small, they pack a punch. They can cause morbidity and they can cause, syempre, disability sa mga patients with diabetes. So, ano ba yung topic natin today? So, preventing diabetic complications. If we go to if you go to the CDC, or the Center of Disease Control and Prevention, this is a reliable source from the US, and we usually use this also as a reference for how we educate patients, no? Kahit sa Pilipinas tayo, we use this as reference kasi it's very easy to read and very comprehensive, very substantial. Marami mong kukuha. So, sabi dito, prevent diabetes complications. Even though diabetes can lead to other health problems, you can prevent or delay these complications in many ways. Common diabetes health complications include heart disease, chronic kidney disease, nerve damage, and other feet, oral health, vision, hearing, and mental health. So there are a lot of complications. And mind you, if you have relatives with diabetes, they're experiencing these complications. Even if they're controlled, they might present with complications in the future. So we have to be observant, with the symptoms. Now, heart disease and diabetes, well, hindi na to nalalayo kasi matagal na namin sinasabi na if you have heart disease or if you have diabetes, you are twice likely to have or develop a coronary artery disease or a heart disease in the future, especially if you don't control your diabetes. Why? Well, it's something to do with the damage, damage ng too much sugar in the blood on the arterial wall. Okay, when we see patients with hyperglycemia or patients with diabetes, that high level of sugar causes the blood wall, the arterial wall, to be more prone to damage and oxidative stress. So if we click here, sorry, na-click ko na pala siya kanina. Ito, yan, heart disease. So, sabi nga dito, diabetes and heart disease go hand in hand, and learn how to protect your heart by simply providing lifestyle changes. It destroys the arterial wall. That is the main culprit here. And take note, a lot of organs have blood vessels. Mind you, it's your heart. Another would be your brain. So, those two essential organs are important for us to preserve, to have a better life, diba? If you have a sudden problem with the vascular structure of those two organs, it will lead to disability and might even lead to death. No? So, heart disease and diabetes. The term cardiovascular disease is similar but includes all types of heart disease, stroke, and blood vessel disease. So, it's also not just MI or heart attack, not just stroke, and not just vascular peripheral arterial disease. Okay? Sabi nga kanina, it's something to do with the walls of your artery. Sabi ko nga, the blood vessels that supply oxygen to the blood to the heart. So arteries they carry oxygenated blood. Veins are the blood vessels that carry deoxygenated blood, okay, to the heart. Now, the problem here is there is too much glucose in the blood vessels. It will lead to damage to the arterial wall. Now, if there is damage to the arterial wall and the smoothness of the surface of the arterial wall is compromised, there is what you call plaque buildup. That plaque buildup will lead to cholesterol deposition. Magde-deposit yan, tatapal yan eventually dahil sa nagawang damage. Okay? Now, once that plaque is built in the arterial wall, it tends to harden the artery. Once it tends to harden the artery, it might even lead to hypertension. Okay? And once that would happen, and there is irregular blood pressure, it might lead to complications like a heart attack or a stroke. Okay? So, aside from that, stroke of the brain, heart attack, and it may even lead to limb ischemia or peripheral arterial disease. So, how does diabetes affect your heart? Sabi nga, your increased sugar damages the arterial wall, leading to, okay, irregular blood vessel wall. With that blood vessel wall being damaged, it will be prone to plaque buildup. Plaque buildup meaning cholesterol ang mabubuo. Okay? Pag mabubuo yung cholesterol doon, it will lead to atherosclerosis and it will harden, titigas. Okay? Pag tumigas siya, eventually, it will compromise yung vascular resistance, making it high blood pressure. Hindi magiging flexible siya to pressure from the body. So, pag mataas ang BP, it will lead to further complications, especially abnormal BP that will cause an MI, it might cause a stroke, it might cause peripheral arterial disease. Okay? Now, ano ba yung culprit doon? Yun nga, yung nagsimula doon. Nasira yung dahil sa taas ng sugar, nag-cause ng plaque buildup. Tumaas ang cholesterol. Okay? Cholesterol in the damaged blood wall is also the second culprit aside from the high sugar levels. Bakit ba tumataas ang cholesterol? Well, your cholesterol can either be coming from your food and it can also be coming from your system. Okay? High triglycerides can lead to high LDL or your bad cholesterol. It will contribute more to more hardening of your arteries. Now, that is why it's important for us to identify din na kung nagkakaroon ka ng diabetes, we have to provide din additional medication. Kung napansin ninyo, mga kamag-anak nyo, na kung meron man mga pasyente na may diabetes, nag-aahad kami ng statins. Ano ba yung statins? Ang statins, these are medications for anti-lipidemic, okay, for the cholesterol. Para hindi sila mag-cause ng hardening effect. That's why we provide statins as medication also for diabetes. And it will lessen the burden of hardening of your blood vessel. Diba? Ano pang other factors that might also lead to the risk of heart disease aside from having diabetes? Smoking. Okay? Yung smoking, well, it also damages the blood vessel wall. Pag meron ka pang high glucose level, then smoker ka pa, it doubles the effect of damaging the blood vessel wall. Damage leading to more plaque buildup, higher BP levels, leading to stroke or MI in the future. Diba? Another, overweight. Kapag overweight ka or having obesity, you have diabetes damaging your blood vessels. Mas double ang cholesterol levels sa iyong katawan. There is double, okay, the chance of developing plaque formation in your blood vessels, more hardening, increased blood pressure, sakit sa puso in the future, stroke sa future. Same scenario. Eating diet with high saturated fat that goes with increase in dietary and endogenous cholesterol. Okay, that is also detrimental. Ano pa? High sugar and high salt. Yung high salt, yun na yung BP. Well, if you have too much salty foods, it will also elevate your blood pressure because of salt retention. If you retain salt, water also retains. So when that happens, your blood pressure also increases. Okay, drinking too much alcohol. Actually, we advise the standard drink lang. Huwag mag-binge drink for patients with diabetes. As much as possible, huwag ka nang minom ng alak. Okay? So, if you have these risk factors, it's high time for you to think about your lifestyle. Try to change it. Iwasan mo yung mga komplikasyon na mangyayari in the future, especially heart disease. Okay? Especially heart disease. Kasi once you step foot in a stage of heart failure, there is no turning back. Heart failure is irreversible. Practically, you cannot reverse a damaged heart. Sakit, no? If you damage the heart, the pumping system fails. Your body will tend to leak out fluid and it will cause edema. It will cause dyspnea. It will cause difficulty of breathing. Yun yung mga ayaw natin mangyari sa mga pasyenteng may heart failure. The topic for heart failure will be for another day, pero it's a quick reminder for you that in the end, if you cannot control diabetes and you develop heart disease, you might lead to heart failure. And that is one complication. I wish patients with diabetes not to have in the future. Well, madali lang naman agapan ang diabetes. Just as long as you stick to the plan, stick to the regimen, stick to the treatment that is provided by your doctor. Okay? So, hanggang doon lang naman yung video ko ngayon. I'm sure. Hi, may dalawa pala akong viewers. Rianel and Cinderella. Good evening. And siguro for the rest, who will watch this in the next siguro few days. Medyo erratic kasi yung videos ko. And I hope it would provide some information about diabetes. We'll tackle diabetes and chronic kidney disease siguro tomorrow to add some insights. Okay? And then for this, if you have questions, you could comment them on the chat. And then if you have any more inquiries about this particular situation, syempre, just message me. Okay? So, thank you for those who watched live. Please do watch the video also in replay if you want. And do like and subscribe. So, this has been Doc Chris. Thank you guys for watching and have a good evening and stay safe. And where is my ending button?